Hello and good evening. I'm Melissa Idris.
And I'm Sharad Kuttan.
Welcome to Consider This. This is the show where we want you to consider and then reconsider what you know of the news of the day. There's a growing divergence in how different countries are responding to Omicron. Some governments are determined to halt the spread of the variant, while others view its spread as a step towards endemicity, living with the virus. Now, this debate comes amid growing evidence of Omicron's less severe symptoms. However, the WHO has warned against categorizing the variant as mild. Now, can Malaysia find the right balance in our public health response? Let's speak first to Professor Tan Sri Dr. Jamila Mahmud. She's the Executive Director of the Sunway Centre for Planetary Health. She was previously the Special Advisor to former Prime Minister Muhyiddin Yassin on public health and had worked alongside the Greater Klang Valley Special Task Force as well as the Health and Sciences COVID-19 Advisory Group of Experts. Dr. Jamila, and became something that was recently in the news. The Bintulu MP had criticized Malaysia's handling or public health response to the Omicron variant, saying that we're not learning enough from China's response to the variant. And it looks like China's standard playbook on this has been enforcing hard lockdowns combined with mass testing. We see in Xi'an, a city of 13 million, has been under strict lockdown for 3 weeks now, with hefty human costs or economic costs. And I'm just wondering where you see the kind of pros and cons of China's approach.
Thank you, Melissa. I think first of all, let's get a couple of things straight. As long as we have vaccine inequity and people are not vaccinated around the world, we will see variants emerging, and some might become more virulent, some might become less. And I think this is what we're experiencing today. And I think that the approaches taken by China may not be suitable for us. We cannot have a one-size-fits-all approach to this pandemic. And I think humility is key, and adaptation as well. So as far as Malaysia is concerned, let me repeat some of the key things where we are different. Number one, we don't have winter. And this is a real plus point for us compared to those with more temperate weather and winter right now. Number two, we have done very well on vaccination. We have really good coverage. We're increasing our booster doses as well. And we know that vaccines do work, particularly with the booster, in preventing severe disease and definitely preventing deaths. And the third thing, of course, is that let's give due credit to our rakyat. They are compliant. The majority of our people are wearing masks. They are, practicing some form of social distancing. And I think we've got to take the majority view as something that has allowed us to not see the surge that one might expect with an Omicron. And I think the fourth thing we have to look at is that, when you look at how you want to manage the pandemic, it's about, again, going back to basics. Basic public health, the testing for symptomatic individuals, testing of people who may be going into indoor gatherings and so forth. And really, putting in place that TRIS that KKM has advocated, which is sound public health advice. But I want to reiterate one very important point, that, we've said this before, the health system is beyond just the Ministry of Health. It has to be broader than that. We need to bring in the private sector. We need to bring in the GPs, who are very critical in playing a role in actually being that, health service providers for the rakyat, where they can go for either quick consultations, they can help with monitoring, they can help to follow up how people are doing. So I think we've already learned so much in the last 1.5, 2 years. We've learned so much from the Greater Klang Valley Task Force and matured in terms of our responses to COVID-19.
Dr. Jamila, we could just go back to the MP of Bintulu's criticism. He points to several things. One is the death rate. He says that Malaysia has a very high death rate. And I think for just anybody trying to understand the successes or the failures of the public health response here, what should they be looking at? Is it the death rate? Is it hospitalization? What numbers or framework should they use in trying to assess in a fair and just way the situation here?
Yes, I think that it is hospitalizations, ICU admissions, death rates, but also excess morbidity, right, and mortality, because this is how you differentiate the impact. But I think that the KKM has come up, and I think this evidence is very important. We are a nation that is obese and has fairly significant number of NCD cases. One in 4 people are hypertensive. There's diabetes is quite widespread. So I think these are compounding factors. It's clear evidence in science showing obesity and diabetes are very much linked with higher mortality and morbidity.
I'm just wondering, with the nature of this specific variant, mild but highly transmissible, I'm wondering what the correct policy response should be. I mean, whether lockdowns might still work. I mean, just taking the example of Australia, which had, really fortress Australia mentality in the start of the pandemic. Now, the Prime Minister saying that the days of lockdown are over. Is that something that Malaysia should adopt as well, that we should take lockdowns, whether it be short or extended or targeted, to be taken off the table completely as a measure?
I think that, my personal view is that the days of lockdowns, complete lockdowns, are over. I think the government has said many times that we need to learn to live with the virus, and let's start learning how to live with the virus. Now, obviously, I say that with a caveat. If there's one particular location that has very high incidence, then we need to interrogate why that is, and whether you need a kind of very limited, confined sort of management of the parameters of that area, right? Whether people are allowed to move.
Dr.
So on
Jamila,
and so forth.
Sorry to interrupt, but can I ask you, I mean, should we make a differentiation between lockdown and tightening of restrictions, which is also a form of targeted lockdown, no?
I don't think that, look at what our country, the government is doing. The restrictions are tightened now in terms of travel to particular places, right? And the quarantine procedures. Now, most countries will still have quarantine procedures and, at home and so on and so forth. But, and I think that we are, we have to comply with some of these, protecting the border. There's some principles in managing a pandemic that are just very basic, but not allowing, the easy importation of viruses, right? But having said that, you also have to balance that against, number one, the pressures on our economy. The pressures on the economy also create serious mental health and also health issues, and also you need to also look at the other health conditions that need to also be addressed. So I think we've got to look at it in a much broader and holistic way. And certainly I do feel that right now, with the policies in place, we have to build public trust. We need to ensure that our rakyat will still obey the compliance and so forth. And one area that I've been harping so many times, which I see very little progress, is a real investment in looking at ventilation, a real investment in putting in filters where it's required, particularly indoors, and also air quality monitoring. Because these are important factors. We know that it is airborne. We know that you have to also put on high quality masks. So how do we make sure that those who are vulnerable are really protected and given the right kind of masks, and supported to protect themselves?
Dr. Jamila, I know it's probably very annoying for you to have to deal with journalists with shorthand. So we have the China model, we have the Swedish model. I think that came at the start of the pandemic. There was the Kerala model that looked at public health systems that are very grounded and dispersed within the community. Where do you stand philosophically on dealing with pathogens? COVID is not going to be the last pathogen we're going to have to deal with. So in the long term, what should we be thinking about in terms of the end goals of our public health system?
We definitely need a reform in our public health system. I believe that we need to look at health much more comprehensively. I mean, this is why I'm doing planetary health, because only 20% of health is created in a medical care complex. 80% of our health is very dependent on the environment, on social and behavioral factors as well. Until and unless we're able to look at health as everyone's business, not just the Ministry of Health, whether it's your, transportation, your land use, the whole impact of climate change on health as well. These are big, big factors. And we also have to look at the fact that, the lifestyle that we are living actually has led us to a lot of non-communicable diseases that and we have seen with COVID created greater problems, but also we are an aging population. So there are many things we need to look at, and I hope that the government will move forward in conducting the health sort of transformation that needs to happen, and therefore more investment. And one big question mark will be, how much do we finance the health system? I think that the amount of financing to the health system is insufficient. We need to pay a lot more focus on public health and preparedness, and we need everyone to work together.
And I like this holistic approach to health, to public health, particularly in the time of pandemics. And it's very likely that Omicron is not going to be the last variant that we see. But again, each variant has its own characteristics. Omicron, mild but highly transmissible. Should policy response shift according to the character of the variant? And if we're thinking about a holistic approach, how quickly, how flexible can that shift occur? Do we have the ability to flex and to adjust accordingly?
Well, I think that there's no single country that can get it all right. I think let's admit that no one has had a perfect response, as you mentioned earlier about Australia and so on and so forth, right? But I think that we have also proven, particularly when we had the surge in Klang Valley, that it was easy for us, not easy, but it was possible for us to bring the surge under control. We put in an innovative mechanism, the Greater Klang Valley Task Force. So when and if required, I am confident that we can innovate and continue to adapt to meet any future challenges that we have. But we all need to work together.
Okay, Dr. Jamila, thank you so much for being on the show tonight. Professor Tan Sri Dr. Jamila Mahmud from the Sunway Group for Planetary Health there. We're going to take a quick break here and consider this, but we will be back with more on this topic, so don't go anywhere. We'll be right back. Bulletin AWANI Berinternet seketika kembali selepas ini. Apa I tengah live ni?
Dah lah, kenapa Astro dia asal hujan je, dia putus. Potong stick dah, dia tengok bola.
Hey, you're so 1998. Tengok je lah dekat phone.
Tak best lah screen kecil.
Dan upgrade lah ke Astro Ultra Box.
Ultra Box, what is the difference?
Hello, rumah you ada internet kan? Astro sekarang dah pakai internet.
Internet? Macam mana konsep dia?
Ya.
Ultrabox dengan Ultibox ni konsep dia plug and play. Sambung je TV dengan modem internet pakai HDMI kabel. Settle. Hujan petir ribut ke, insya-Allah tak ada apa-apa. Dah, dan remote. I nak live balik. Talk to you later. Bye. Bertemu kembali.
Oh. Okay, bye. I WhatsApp Astro je lah.
Di Kasem ada banyak pilihan kereta terpakai berkualiti dekat sini dan dihantar terus ke rumah bila anda beli. Kasem. Pip, pip. Kemungkinan tanpa had menanti apabila anda dikuasakan oleh jalur lebar Unify Home. Selami emosi dan rasai keterujaannya. Dengan Unify Mobile, setiap detik pasti tidak akan terlepas. Serta kongsi kegembiraan dengan mereka yang amat bermakna. Nikmati 100,000 jam hiburan pilihan anda. Unify duniamu bila-bila masa di mana-mana sahaja. Unify.
Hi, thank you so much for staying with Shrad and I on Consider This. However, if you've just joined us on the show tonight, we're discussing the diverging public health responses of certain countries to the Omicron variant. Dr. Koh Swee King of the Malaysian Health Coalition joins us now. Swee King, there's this debate that's been heightened with the arrival of Omicron, whether the best approach is to tighten restrictions to help stop the spread, or to continue on living with the virus to achieve endemicity of living with COVID. Where do you stand on this debate, Swee King?
Melissa, happy New Year to you and to Shara and to everyone else listening. Hopefully we'll have a great 2022. Melissa, I stand on this debate on the side of balance and moderation, but also to take one step back, I stand on the side of making a social contract with the people and the citizens of specific countries to decide with the citizens of that country what they're willing to accept. The question is, which model is the best model? But the earlier question that we should ask ourselves is, what are we trying to achieve with that model? Is the model that we're trying to implement intended to achieve reduced cases, or reduce hospitalizations, or reduce deaths, or to balance all that with, shall we say, a return to normal where we're able to go out, travel, socialize, and to maybe reopen schools and reopen the economy? In other words, the right model to choose depends a lot on the social contract that governments will have to sign, and in many cases, re-sign with their population. The implicit meaning behind this, Melissa, is that for the last 2 years, many governments around the world have been very heavy-handed in their policy responses, being very paternalistic. Decisions are made in central governments at the capital cities of the world without really consulting the population. Therefore, lockdowns, no lockdowns, restrictions, no restrictions, vaccinate, boosters, or to open up our borders. These decisions are made without consulting the public. Therefore, the right model to apply really must depend on a social contract that we must sign, and in also many cases, re-sign with the population.
Speaking, some wonderfully democratic impulse there in what you just said. Of course, democracies are messy, and I think that today the conversation also is split on how people view their societies and how they organize. And they look to China and they see discipline, they see centralized leadership that is decisive. I mean, the consequences aside, versus the messiness and the noise of democratic Western Europe. So when you kind of look at Malaysia, where do you think we could do this better? I mean, the conversation, how do we appeal to the very different impulses in Malaysian society about what kind of a country they want to live in, what kind of governance they want to be under?
Shara, this is a great question, and maybe if I were to put some, some numbers onto the table and just draw two examples of two separate, very different countries, and then put Malaysia in the middle. The first country is China. 1.4 billion people, 100,000 cumulative COVID cases. 100,000 cases for 1.4 billion people in 2 years. Last year, in 2021, the World Bank expected that China would have grown their economy 8%. 100,000 cases only cumulative for 2 years, 8% economic growth. In contrast, the United States, a population of 300 million people, 60 million cases out of a population of 300 million people with an economic growth of 5.6%. So at least on paper, you see that China appears to have controlled their pandemic very well and also has grown their economy at 8.0% as opposed to 5.6% for the US. Now, these are not apples to apples comparisons, I agree, but let me set that aside and talk about Malaysia. To talk about Malaysia, let's use a few words to characterize the US and the Chinese response. The US response is perhaps characterized by freedom, or an emphasis on freedom and individual rights. Indeed, because the US is shaped in a way that states have a lot of power in relation to the central or federal government, then it's also characterized by a lot of state-led decisions. Whereas in China, it's almost a polar opposite of the US. It mirrors their governance structure, much more control instead of freedom, and much more centralized instead of decentralized. In Malaysia, we're very centralized in our health system. And maybe one word that can describe Malaysia is, well, I struggle to find a word actually, because there isn't a theme to Malaysia's policy making in the first 2 years of COVID. In the first year of COVID, maybe the word was lockdown in 2020. In the second year is vaccines. And maybe the word that defines our 2022 in Malaysia is booster. So lockdown to vaccine to booster are three words that describe single solutions for each three of the phases of COVID so far. What we need in Malaysia is a non-ideological approach that has all factors in play rather than only focusing on lockdowns in year 1, vaccines in year 2, and boosters in year 3.
Should the response, the correct response, be, as opposed to ideology, I guess, flexible enough to take into account the characteristic of the variant? We had a type of approach to Delta, now Omicron being having milder severity in terms of symptoms, but highly transmissible. In fact, the WHO warned against categorizing it as mild. I'm just wondering, you talked about ideology of each country, and as we enter the third phase, the third year of the pandemic, whether it's not so much about the ideology of the public health response, but how we respond to the type of mutation the virus has taken on.
Melissa, you're very right in saying this. So I believe in a non-ideological approach to public health, which must be science-driven. However, if I may elaborate a little bit on the science, that's 50% of the puzzle. The remaining 50% is what science cannot tell you. So what science can tell you is Omicron appears 3 to 5 times more transmissible compared to Delta. It causes more breakthrough infections. Breakthrough infections are infections after you've been vaccinated. It also causes reinfections. Reinfections are infections with COVID a second time. So you're reinfected with COVID. The science of Omicron, what we know about it, should really inform the way we do public policy and health policy. Absolutely certain, and I very much agree with that. And I hope that Malaysia does a lot of more evidence-based policies. But science only takes you so far, because science is incomplete, science is imperfect, and science changes over time. And the other components of decision-making should really be good political choices. Fortunately, after 2 years, we can, if we truly wanted to, implement good lessons from any number of countries in the world, from Vietnam, from Thailand, from Singapore, from New Zealand, from South Korea, from Japan. The point I'm making is that when we look at science that takes you 50% of the way, it's not enough to just give rhetoric and lip service to science, but also to talk about the good political choices that different countries have made and to see what we can learn from them. So I'm fond of saying that health is a political choice. And for pandemics, not just for the last 2 years, but also for the next 2 to 5 years, will require us to be very cognizant of the science, which will take us halfway, and also the political decisions that needs to take us the full way.
Swee King, I mean, if we could sort of pin down some of those wonderful sort of ideas to specifics, where would you say we're doing things right and need to continue, and where do you think we're doing things wrong and might require a U-turn, turn left or right, whatever it may be, in order to recalibrate our response?
Hopefully, turn left or turn right, Shara, but never flip-flops. To go back to the question of what we're doing well in Malaysia, maybe 2 or 3 things. Firstly, our vaccination program is doing well, and it's got a very clearly defined booster strategy, a child strategy, as well as an adolescent strategy, all of which is very welcome. And I think we are almost world-class when it comes to our vaccination program. So well done to the people managing the program. So that's one high point of Malaysia's strategy. Number 2, Malaysia is increasingly using the private sector to deliver care that would otherwise be delivered by the Ministry of Health. This is good because the Ministry of Health, heroic as they are, and all our 50,000 doctors, 70,000 nurses, and 15 or so thousand environmental health officers, they're all doing a fantastic job, but they cannot do it all, which is why we have to partner the private sector in ways that are predictable and transparent. And it's encouraging to see that we're increasingly partnering the private sector, especially general practitioners, in ways that are very holistic and much more sustainable and transparent. So that's very good for Malaysia as well. However, Sharad, in the third year of COVID, here are different things. Here are some things that we can do differently. The first thing that we can do differently in the third year of COVID is not to have single magic strategies. Like I said, in 2020, the magic strategy was lockdown. In 21, the magic strategy was vaccine. We hope that the magic strategy in 2022 will be booster shots. But booster shots really have to be paired with a strong enough testing strategy. So we got a national testing strategy announced on the 26th of October, I think, or November, I apologize. It's a fantastic strategy, but there's no implementation plan, and we don't yet see enforcement. So we need to have good testing, and then it needs to be very quickly reported. So if I test positive, I have to very honestly report it on my Sejahtera. It needs to trigger a chain of activity that puts you in home isolation, issues you a home surveillance order, issues you a release order after 10 days in ways that are very simple, smooth, and understandable for everyone. In other words, it's the third year of this pandemic. We cannot afford to treat the third year like a dress rehearsal. We should really get all the simple, basic building blocks of public health down to a T, shall we say, and that's one important area that we can do well in. And perhaps finally, if I can add one more, it is an appropriate role for decision-making for the Ministry of Health. We often see that decisions for MCO, how long, how intense, and the decisions for National Recovery Plan, how long, how quickly to go through different phases and so on, are not made by the Ministry of Health, but made by the National Security Council and the National Recovery Council. There needs to be an appropriate stature given to the Ministry of Health for them to truly own the decisions based on their current data and also their surveillance and prediction models. It cannot be lip service that we have a mid-level functionary from the Ministry of Health attending NRC and NSC meetings, sitting in a corner and then going around having a quick conversation and then saying that we've already obtained MOH input. In other words, what we can do better, give MOH much more stature in decision-making than they're currently receiving.
Speaking, I want to ask you, because you talk about evidence-based policymaking, are we collecting enough data? Is the data out there shared by all kinds of observers and analysts so that we can have a robust discussion? Everything from the impact on our healthcare system to maybe evidence of long COVID and the necessary policy responses to long COVID. Do you see any of that happening?
Sharat, evidence-based policy making is the moving goalpost. You can never have too much evidence, and you must have enough balance that you have enough to make decisions, so not too little. But if you have too much, then you'll be paralyzed by decision making. So these are the, shall we say, more philosophical elements of evidence-based policy making. It's a moving goalpost. Plus, you can't have too little or too much. Having said all that, I'll say that Malaysia is increasingly showing more data transparency, which is great, very belated, but great. Data for vaccinations stratified by age, the hospitalization stratified by state and all that are increasingly, or not increasingly, already available on covidnow.moh.gov.my. Fantastic. But that's, shall we say, yesterday's data. It's great that we have access to the data. Now we want new data. For example, what does the surveillance models tell us? What does the SEIR model tell us? And what are the projections for Omicron? We'd love to see that. Number two, right. What are our genomic, shall we say, surveillance rates? Number three, what's the impact on health system, especially non-COVID? We'd like to know how many surgeries have been postponed, what's the mortality rate like for diabetes and cancer cases and so on. So non-COVID data is also very important for us to talk about. In other words, it's a moving goalpost. We should have more and more data as we go along in this pandemic.
Thank you so much for joining us on the show today, Dr. Koh Swee King there of the Malaysian Health Coalition. And that wraps up this episode of Consider This. I'm Melissa Idris.
And I'm Sharat Kuttan, signing off for the evening.
Thank you so much for watching. Good night.
Good night.